very good morning, students. After completion of the bony features of the femur, now we are ready to learn about the muscular and ligamentous attachment onto the femur. Now look at this femur. Okay, I have just kept the camera at a higher level because it is not focusing the whole of the femur in one go. Okay, otherwise the details will not be visible. Okay, now see here, this is the head which faces medially upwards and slightly forward. Okay, so this is the head which is facing medially, and then when you will trace your finger on this femur, the anterior surface is slightly convex and smooth. So this this femur belongs to that of the left side. So identified that this is the femur of the left side. Now we come to the attachment, muscular and ligaments onto the upper end first, and I will bring it close to the camera. This is the posterior aspect and this is the anterior aspect of the upper end of the femur. The head is smooth, almost spherical here, and this shows a pit here. Okay, and this pit is the site where there will be the attachment of the ligament of the head of the femur, or ligamentum teres. Okay, so after the head, when we will see, this is the neck which is at an angle with that of the shaft. Okay, and we have seen the angulation of the neck and head with that of the shaft in the last video. This is the anterior surface of the neck which is extending right up to a line called as the intertrochanteric line, where I am, just let me show you with the pen. This is that greater trochanter, and this line which is extending rough, it is the intertrochanteric line, which on the posterior surface becomes continuous with that of the spiral line. Okay, just below the lesser trochanter. Now if you see the attachment onto the neck, the articular capsule of the head, articular capsule of the hip joint is attached onto this intertrochanteric line, just upper aspect of the intertrochanteric line. Let me draw it with the chalk. So this is the site for the attachment of the articular capsule, and just onto the ridge or on this intertrochanteric line, there is attachment of a very strong ligament of the body, and that is called as the iliofemoral ligament. So this is the long extension of the iliofemoral ligament, which starts from the lesser anterior inferior iliac spine of the ilium, and it gets expanded here and gets attachment onto the whole of the length of the intertrochanteric line. Okay, so these are the two attachment onto the anterior aspect of the neck. That means whole of the neck on the anterior aspect is intracapsular, because this is the site for attachment of the capsule. But when we will turn this femur onto the posterior aspect, then this attachment of the capsule is not into the whole of the length of the femur neck, but it is almost in the middle of the neck. So this is the attachment of the articular capsule in the middle of the neck onto the posterior. That is the difference of the attachment of the neck onto the anterior and that of the posterior surface of the neck. Let us come to the attachment of the greater trochanter. Okay, you have already noticed that this is the greater trochanter. Okay, and this has an anterior surface, a lateral surface, and a posterior border, and then there is a superior border is here. Let us see the attachment of the obturator internus and the two gemelli, okay, or gamellae. And this obturator internus and two gemellae, they are inserted onto the medial surface of this greater trochanter. This surface where I will put the pen here, this just behind Okay, I mean say just in front of that of the trochanteric fossa, which is placed more posterior. I will show you the trochanteric fossa is here, and just in front of this on medial surface, this is the obturator internus and two gemelli are inserted. Now the obturator externus is attached to this trochanteric fossa. Okay. Well, after seeing the attachment of the obturator externus and internus, let us see the attachment or insertion of a muscle, Pyriformis. This muscle is attached onto the upper border of the greater trochanter, where I am marking its insertion with that of the chalk. Now onto the greater trochanter, this is the anterior surface, this is the lateral surface of the, on the anterior surface there is the attachment or the insertion of a muscle called as gluteus minimus. Gluteus minimus. While onto the lateral surface of this greater trochanter, this is the insertion of another glutei known as the gluteus medius. So this is anterior surface, gluteus minimus. On the lateral surface of greater trochanter, it is the gluteus medius muscle is here. Okay. Now let us see the structure onto the posterior aspect of the upper end. Now here at the junction of the neck and the shaft, this is the conical projection which we have seen that it is called as the lesser trochanter. Now this lesser trochanter gives attachment to muscle called as the psoas major. It is called as psoas major onto the tip and to the surrounding area of the lesser trochanter. This is the psoas major. Now between the greater trochanter and lesser trochanter on posterior aspect at the junction of the shaft and the neck, this extent a crest. Okay, this is called as intertrochanteric crest, and in the middle of that this is the tubercle called as quadrate tubercle, and this quadrate tubercle gives attachment to the quadratus femoris muscle. So this is the quadratus femoris muscle. Now if we see the shaft, okay, after completion of the attachment of the upper end of the femur, let us come to the shaft. This is the posterior aspect of the shaft where linea aspera, gluteal tuberosity, spiral line are seen. This is the supracondylar line, that is medial, and this is the lateral supracondylar line. This is the anterior convex surface of the shaft. So now we will see the attachment of the shaft first onto the posterior aspect. Let us see where is the attachment of the iliacus and pectineus. Now just below the greater trochanter, lesser trochanter, this is the site for the attachment of the iliacus muscle. Okay, so this is the psoas major, and then this is the iliacus muscle which takes origin from the iliac fossa. Okay, and then there is below that, okay, there is the attachment between this spiral line. You can see this line. Okay, and this is that gluteal tuberosity. In between the two below is this is the attachment of the pectineus. So psoas major, iliacus and pectineus, they are on this. Let us see the origin of the muscle, what is called as the vastus medialis, which will take origin from the medial aspect, mostly from the linea aspera, medial lip of the linea aspera, but it starts taking its origin from the lower end of the intertrochanteric line, which is on the anterior aspect. So I am drawing it here, the lower end of the intertrochanteric line, then it extends onto the spiral line. So I am drawing it onto the spiral line. So this is its linear origin. Then it will take its origin from the medial lip of the linea aspera. Okay, so I am drawing it onto the medial lip of the linea aspera, and it extends right up to the medial supracondylar line. Right up to the medial supracondylar line. This is a very extensive origin of the vastus medialis, but it is linear origin. Similarly, if we see the origin of the Vastus Lateralis, then this Vastus Lateralis takes its origin from the intertrochanteric line just below the greater trochanter or on the surface of the greater trochanter. Then it winds round and goes posteriorly just lateral to that of the gluteal tuberosity. See, this was the gluteal tuberosity, just lateral to the gluteal tuberosity. Then it takes origin from the lateral lip of the linea aspera, this ridge. Okay, I am drawing on this, the linea aspera, and it may go right up to the lateral supracondylar line and will stop just above it. Okay, not going as down as that of the medial this Vastus Medialis. Vastus. So this is the Vastus Lateralis and Vastus Medialis. Now then we see the extensive origin of the Vastus Intermediate. Vastus Intermediate takes its origin from the anterior aspect, which is convex and smooth, and the anterior aspect of the shaft of the femur. They are not only onto the, but it also extends onto that the lateral aspect, going right up to the origin of the Vastus Lateralis. So this is the Vastus Intermediate, which is has a fleshy origin extension. The other two, Lateralis and Medialis vasti, they were having the linear origin, but this is an extensive from the surface of the bone on anterior surface and that onto that of the lateral surface of the bone shaft of the femur. This is the Vastus Medial Intermediate. Okay, so we have seen the origin of the Vastus Medialis, Vastus Lateralis, and the Vastus Intermediate. Now we come on to the dorsal and posterior aspect of the bone where linea aspera is present. Okay. Sorry, I have already told you about the medial lip, which gives origin to the Vastus Medialis, and lateral lip, which gives origin to the Vastus Lateralis. Okay, in between these two lips there are many muscles which are attached, many intermuscular septa which are attached, which I cannot show you in this narrow space. So you will have to learn it theoretically. So I will teach you this attachment onto the linea aspera, okay, on a diagram so that you can extend. Just keep the bone in this way so that this will be an orientation. This is the medial side, this is the lateral side, because head is facing towards the medial side. So I will bring a diagram and will try to draw it on this diagram. Okay, so this is a diagram very roughly drawn for the left femur. See, this was the left femur, this is the linea aspera, this is also the left femur, this is the linea aspera, and on this linea aspera we have seen on the lateral, this is the lateral lip of the linea aspera, which gives attachment to the origin to the muscle called as the Vastus Lateralis. Just I am drawing here. This is the attachment of the Vastus Lateralis, which will go to the anterior aspect, and onto the lateral surface also of this bone there is the origin of the Vastus Intermediate. So this is Vastus Intermediate, this is Vastus Lateralis, and on this lip, that is the medial lip, there is the origin of the from spiral line, then going anteriorly also, but we are showing you here only onto the medial lip of the bicipital, medial lip of the linea aspera, right? This is the Vastus Medialis. So Vastus Medialis, Vastus Lateralis, and Vastus Intermediate, these are the three origin I have shown in relation to that of the linea aspera. Now, since I cannot draw everything in such a narrow space of the linea aspera, I have expanded this diagram. See, this is the same. See, this is the medial side and this is the lateral side. Okay, so with the pen, blue pen, I have shown you the position of the three intermuscular septa. Okay, this is the lateral intermuscular septa, this is the posterior intermuscular septa here, and this is the medial intermuscular septa with the blue pen, okay? So these are the attachment on linea. So this is quite an expanded linea aspera, right, from here to here. This is the lateral lip, okay, of the linea aspera. This is the medial lip of the linea aspera. Okay, let me draw the attachment of the lateral Vastus Lateralis. Okay, so this is the Vastus Lateralis. Beyond this will be the Vastus Intermediate. Okay, and this is the Vastus Medialis here. Okay, this red line indicate the Vastus Medialis here. This will just I have drawn for your orientation. Okay, your orientation. Now most of this muscle onto the linea aspera they are inserting, except one muscle which is taking origin, and that is the short head of the biceps femoris. So this is the short head of the biceps femoris which is taking origin from here, right? Otherwise most of the muscle, as we will see, this is the gluteal tuberosity where the gluteus maximus is attached, okay? And just below the gluteus maximus or gluteal tuberosity another muscle is inserting here, and I will just put it the blue color, and this is the Adductor Magnus muscle. Okay, this is Adductor Magnus. Short discontinuity where there will be the popliteal vessels will pass through in it, right? And this is the tendon on to the adductor tubercle. So this is the insertion of the Adductor Magnus muscle. Then there is insertion here, that is the Adductor brevis. This is the pectineus, and then this is the Adductor longus muscle. Adductor longus muscle. And I told you in front of this line, blue color pen line, is that of the medial intermuscular septum, and this was the lateral intermuscular septum, and this is the posterior intermuscular septum. So in this part, how many of the muscles are inserting? It is the pectineus, Adductor longus, Adductor brevis, and Adductor magnus. Okay, and this is Adductor tubercle where the ischial part of the Adductor magnus tendinous insertion will be there onto the Adductor tubercle. And sorry, this is also the gluteus maximus insertion. Okay, this is the insertion on the gluteal tuberosity, not origin. Okay, this is the insertion of the gluteus maximus muscle, except one origin, that is the biceps femoris, short head. Okay, all other are the insertion. Now this is an expanded diagram of the linea aspera where you will have to remember many attachments. Okay, many attachment and 3 intermuscular septi here. Now we will go to the lower end, attachment onto the lower end of the femur. And in the lower end of the femur, most of the attachment is they are onto the posterior aspect. Let us see the attachment onto the posterior aspect. They are in relation to the medial and lateral condyles of the femur. Right. Let us see the attachment of the first muscle, which we will see is the popliteus, and this popliteus muscle is attached to the lateral condyle. See, this is the femur, and this is the lateral condyle, and this is the medial condyle of the femur. The popliteus muscle takes origin from here. This is the origin, and then its tendon lies in the groove. This is the origin in the depth pit. This is the popliteal fossa, and popliteal groove is here from where it takes its origin, right? So this is the popliteus muscle. Then there is the attachment of the medial and lateral gastrocnemius muscle. Now the medial will take origin above the medial condyle, okay, epicondyle here on the posterior aspect, and this is the medial gastrocnemius. This is the medial gastrocnemius muscle is attached here, okay, just on the popliteal surface actually, popliteal surface. I will just put it here onto the Popliteus. I'm sure, sorry that this is not seen very properly here. So this is the medial gastrocnemius because head is on this side, okay? And then there is a lateral gastrocnemius onto the lateral surface here. This is the origin of the lateral condyle. This is the lateral gastrocnemius. Now, above this, there is from the lateral supracondylar ridge here, there is the origin of a muscle called as plantaris, okay, a small muscle. That is the plantaris. The adductor magnus will take its attachment onto the adductor tubercle. See, this is the adductor tubercle, which is above in continuity with that of the medial supracondylar line. So this is the adductor tubercle is here, where there is attachment of the tendinous part of the adductor magnus. Let us come to see the attachment of the medial and lateral, anterior and posterior cruciate ligament, okay? The posterior cruciate ligament, which you will learn in the knee joint, gets attachment onto the medial condyle. This is the intercondylar notch, and this is the lateral surface of the medial condyle, where I am moving my finger. Medial surface of the, lateral surface of the medial condyle. Here is the attachment of the lateral cruciate ligament. This is the lateral cruciate condyle, and this is the medial surface of the lateral condyle, where there is the attachment of the anterior cruciate ligament. So posterior on medial and anterior on the lateral condyles of femurs, they are attached into the intercondylar fossa, okay, onto the walls of the intercondylar fossa. There will be a short muscle here, articularis genu, okay. There may be a small bundle of the muscle fibers may attach here onto the articularis genu. Let us now come to see the ossification of the femur. I will just draw the femur and will tell you about its ossification, okay? About the ossification. Let me have a page, and I will, on this page, I will draw you the ossification of the femur. Okay, if I draw a very rough idea about this is the head of the femur, say for example, greater, lesser, just a rough diagram. This is the lateral condyle, this is the medial condyle, for example, here. Okay, then this femur ossifies in the cartilage, so there is an interchondral ossification. The primary center of ossification for femur, it appears in the shaft, middle of the shaft, at the 7th week of intrauterine life. 7th week of intrauterine life, okay? And then this cartilage is gradually being replaced by the bone on both the ends, okay? Upper end as well as towards the lower end, okay? And then just before the birth, okay, just before the birth, and another center appears for the lower end, and this is at the lower end before birth, say about the 9th month of intrauterine life, okay, just before birth, and this is called as the secondary center of ossification. So when the birth takes place, there is a little bone has already formed at the lower end, and the shaft is also bony, okay? So when you take an X-ray, this a big white patch and a small dot will be seen. Then after birth, another secondary center appears for head. It is for in the first year of life, okay, first year of life after birth. And then there will be a center for appearing for that of the greater trochanter, okay, and this will also start forming. That is in the 4th year. This is the 4th year of the life. This is the first year of the life of a child, where the head center first, it will start forming the bone for the head, okay? So there will be the formation of the bone for head, bone formation after 4 years for the greater trochanter, and there will be the formation of bone after this part. And then at puberty there will appear a third center. At puberty means it around 12-13 years or 14 years of age, and this will also form the bone of the lesser trochanter, and then this bone will form. So at the time when a person is about in his teens, going into the teens, there are already bone formed, okay, except there are some cartilaginous plate which are called as the epiphyseal plates, they remain. Okay, then the secondary centers of the upper end, which are 3 in number, they will start fusing with the diaphysis which is formed by the primary center at the 7th week of intrauterine life, and they will fuse at different ages, but they will complete their fusion, okay, by the 18th year. So after 18th year, nothing will be cartilaginous plate will be seen, okay, epiphyseal cartilaginous plate will not be seen. It will be, upper end will be complete bony. Then for the lower end is still the epiphyseal plate is there, and this, the center which had appeared just before birth will also will fuse with that of the primary center at the around 18 to 20 years of age. 18 to 20 years of age. That means after 20 years the bone will complete its ossification, and since the lower end has appeared just before birth and fused last by the end of 20 years, so this is the growing end. So the lower end is the growing end because the center which appears first unite last. So now the significance of the lower growing end or the appearance of a secondary center before birth is that in case of the viability of a child is defined as that after the birth a child will be able to survive, okay. In olden days, say 40-50 years back, most of the premature labors the childs were dying, okay, they will not be able to survive. But now, okay, it is not that means almost every child survives because of the development of the medical facilities and technologies, okay. Child don't die after the premature labor, even after the 6-7 month child of the pregnancy they are surviving. But suppose, okay, especially in case of female child, most of the communities were killing their female child and saying that it is an abortion, stillborn, okay, dead child was born, okay. So if the center is there, that means which appears just before the birth, it means that the child was of the 9 month of intrauterine life just before birth. It cannot die, okay, abortion cannot take place usually, okay, and that means there are chances that the parents have killed that child, okay, okay. So by seeing the appearance of the secondary center in the lower end, one can see whether a child can survive or cannot survive if birth takes place at this age, okay, at this age. That is the importance of the ossification center of the lower end. This completes the bone, muscular and the ligamentous attachment of the lower end. Thank you very much for watching this video.